Neural crest cells arise from the dorsolateral aspect of the neuroectoderm at the boundary between the neural plate and surface ectoderm, transforming into a migratory cell population during neurulation. This transition, guided by the sonic hedgehog and bone morphogenetic protein gradient, is essential as these multipotent cells disperse throughout the developing embryo to form an extensive variety of tissues and structures. The primary derivatives are frequently classified by their functional and anatomical destinations. They migrate both dorsolaterally into the ectoderm and ventromedially, forming critical components of the peripheral nervous system. This peripheral nervous system contribution includes all sensory ganglion cells, spanning the dorsal root ganglia of spinal nerves, where they form pseudounipolar neurons, and the sensory ganglia of cranial nerves, including the trigeminal, facial, glossopharyngeal, and vagal nerves. Additionally, neural crest cells are responsible for the entire autonomic nervous system, differentiating into all postganglionic sympathetic neurons, which aggregate to form the sympathetic trunk and prevertebral ganglia, as well as all postganglionic parasympathetic neurons in the visceral walls, such as those within the terminal ganglia and specifically the submucosal Meissner and enteric Auerbach plexuses. Dysfunction in this migration, particularly to the distal colon, results in Hirschsprung disease, characterized by the lack of ganglionic cells and subsequent congenital megacolon. Another major role is the production of non-neuronal supporting cells, specifically Schwann cells, which ensheath all axons of the peripheral nerves, and satellite glial cells surrounding neuron cell bodies in the sensory and autonomic ganglia. A substantial derivative of the trunk neural crest is the adrenal medulla, where the cells specialize as chromaffin cells, effectively serving as modified postganglionic sympathetic neurons that release catecholamines into the circulation. These cells, along with those in autonomic ganglia, contain characteristic neurofilaments and secretogranins, which can be diagnostic markers in tumors like neuroblastoma and pheochromocytoma. A distinct and major subset of cranial neural crest cells, often called the ectomesenchyme, forms the bulk of the connective tissue and skeletal structures of the face and skull. These cells migrate from the rhombomeres into the pharyngeal arches, where they form the maxilla, mandible, zygomatic bone, and squamous temporal bone via intramembranous ossification. The pharyngeal arch cartilages, including the malleus and incus from the first arch and the stapes from the second arch, also arise from the neural crest.